when a patient passes away, a lot of physicians process it very differently, and I'm sharing with you what I do. And there's two different ways that I process death, and I've seen a change in how I process death as my career has moved on, and as I've become more experienced, and also my setting has changed. When I was an employed physician as a hospital medicine physician, I was on for about 7 to 10 shifts, and so I got to know the family and the patient briefly. And so when a particular patient would pass away, or in that event, I would be sad, but I was more frustrated with how the system has failed them, or a blood pressure wasn't taken care of and they had this massive stroke, or they couldn't get their medications because the cost was too high, those kinds of things. Compare that to now in my private practice, where I have direct access to my patients and we actually have a true long-lasting relationship. It is much different. And so there's actually a feeling of gratitude, there's a feeling of appreciation, there's a feeling of respect, there's a feeling of being part of someone's life genuinely, as you've seen them and taken care of them through the various stages of their illnesses. And I'm going to share with you some of the things that I've seen in my life. Is I've had moments where it just bothers you, and you sometimes physicians like myself may get quiet at times if we're at parties or things like that. It's because you're still processing it. It hurts, and you try to give the best care to your patients, and you constantly are thinking, what else could have we done, or someone could have done, or where could the system get better. At times when I'm angry at the healthcare system, just through the denials, or the medication denials, or the facility denials, those are, it frustrates you. And a lot of physicians have burnt out and left practice because they've allowed that to consume them. And so that's why when we start a private practice, or we engage in other activities where we have some control, it really helps your career. So that's my advice to a lot of physicians, is to do something that gives you purpose and helps you, or else you're going to burn out with the emotional roller coaster that you see. So physicians are a different breed. I mean, it's very unique to be a physician. You're taking care of people in the most vulnerable state, and it's intense, and you're making a lot of difficult decisions, and you're managing not just the patient, but the treatment team, their family, the relatives, and also coordinating the care with multiple other professionals. So there's a lot going on. And I think that's where we need to definitely make some improvements as a profession. Is I think we need to talk about it. We need to share how we feel. There's debriefing exercises that they talk about, but you're so busy in the hospital setting that there's no time to huddle or get together to debrief after in a meaningful way. I mean, 5 minutes of just talking about how did a code run, and making sure everybody did their jobs, what could we get it better, but there's little talk of how are the caregiver, how are the treatment team, the nurses, the physicians, the techs, everybody who witnessed a code. I mean, it's a very traumatic experience. And if you're the one doing CPR on somebody and going through those, that rush, that adrenaline rush, you need a moment. And I don't think we do a good job right now as a profession to allow people a space or time to recover from it, because the next day you're rounding on another 15, 18 patients, or you're seeing patients in the office, or you're back in the OR. I don't think that's the right way to do it. So I think this is a huge opportunity for improvement, but I also want to raise awareness to everybody out there, because understand that your physician is going through a lot of emotional roller coasters. One door, you're celebrating wins, you're celebrating somebody getting better from pneumonia. The next door you go into, you're talking about a terminal illness, or you're talking about a horrible diagnosis, an impact that on their life. And then you go to the next door and you're celebrating a win again. And so you're just on this constant roller coaster. And it does wear on you. And so I just ask for folks to understand that and it can lead to physicians, it's not an excuse, but I'm just saying it can lead to some physicians can be agitated. They may have a lower threshold, of tolerating certain things, or they may get emotional more often. And so the best thing I would recommend to any medical students or residents or physicians, young professionals, is to give yourself at least 30 minutes when you come home. My wife knows sometimes I'll say I just need 30 minutes, and I need to sit on the porch, or I need to sit somewhere, and I just need to think of positive thoughts, or I need to do something more positive. And so if you're also in a gathering, in a party or something, and there's a lot of negativity, chances are a physician is going to stand up and leave. Because there's enough negativity that we see throughout the day, or there's enough badness that we see. I think we're so thirsty for positivity at the end of the day, or at the end of the week, or whatever. And so that wouldn't be a surprising behavior for a physician to do that at a gathering. So I think there's a lot of understanding, a lot of conversation that needs to be had here.